I'm checking on the program, which I don't know where it is. And sorry for that. Okay. Yeah, I can see from the program, we are supposed to have welcoming remarks. Then we will have the keynote address from our chair, Immaculate. We will also have an address from our finance chair, then logistic chair, Carolinda. Then we will also have remarks from Ruth Mwendo. Then we are going to have breakaway sessions, and I would ask to be supported here on how it will happen, because I also don't know. So as part of my welcoming remarks, I'm welcoming you to today's runoff, and I want to say thank you so much for creating this time, because it is the only way we will know how our conference is going to happen. I'm not very sure whether today we have people who are going to participate physically from wherever, I don't know, from the studio, so that we can have a feel of how blended it's going to look like. So thank you so much and welcome. I now want to invite our chair, Immaculate, to give her address. Immaculate, please.
Dr. Immaculate.
Sorry?
She's not here yet.
Thank you. I saw Oscar. Oscar, please, can you give your address?
Good afternoon, Dr. and colleagues on the call. I want to try and see if I can make a presentation. So as part of our preparation, allow me to just show some slides, a few of them.
Okay. Yeah? Mm-hmm. Thank you. Yeah, go ahead.
All right. 9 sekunde. Can see my screen?
Yes, we can.
Okay. So I have been asked to speak today as the chair of the finance committee. My name is Oscar Kadenge. But being an ECD person, I want to take this opportunity to just draw attention to something that I feel over time, even as we go into this conference, we would need to be able to talk about. First, I know that all of us on this call or on this platform today are practitioners and implementers, advocates, people who support early childhood development and who have actually moved the needle in Kenya from the time that we began talking about early childhood as not just preschool education, but something more than that. And therefore, I want to laud each one of us for moving the needle. But I think now we are coming to a place where we need to shift the ground. And the 4th ECD National Conference provides us with that kind of an opportunity. But we need to step back a little bit and remember something about the rights perspective on early childhood development, so that even as we talk about investing in the early years, we will actually put our money where our mouth is. So I want to just talk about the Convention on the Rights of the Children. It was passed in 1989. Most of us are aware of that. It was a framework for all actors on behalf of children. So each one of us on this call remembers that every time we go out planning, every time we go out speaking, we are doing that on behalf of children. We want to remember that the convention also addresses civil and political as well as economic, social, and cultural rights in one instrument. It is applicable to all children in all situations all the time. That's very important for us to remember, so that even as we talk today, I know I've seen people like Mumbi on the call who are actually bringing to the fore a particular cadre of children that have been forgotten for a long time, those who are incarcerated. And we want to also look beyond just those to children in special circumstances across the country. And then if we are looking at a treaty that has been most ratified, there's none like the CRC. This is the one that actually frames a lot of what we do. And even the UN General Comment number 7 on early childhood is actually a product of this particular convention. I want to talk about the rights of these children. We said all along we've been talking about the right for the right to life, the right to survival, the right to development. We've said we are moving from just survive to thrive to transform. So when you're talking about rights, and I want us to now begin thinking about who are the people that we are going to be speaking to on behalf of the children. There's the Convention on the Rights of the Child requires states to take positive action for our children. It requires access to basic services, and it is very holistic because it covers both all the components that we talk about in terms of the development of a child, the physical, mental, spiritual, moral, and social development. And I put in that spiritual because I have seen an effort that is currently on course to try and take away religious education. I've seen the Atheist Association saying they don't want people to be children to be brought up in a spiritual environment. As advocates, as people who are going to be speaking at this 4th ECD National Conference, we want to be able to say that that's something that cannot be taken away because it is part of the CRC. And then when you think about it, the CRC also speaks about non-discrimination. So it covers all children. And this says that all children have the same right to develop their potential, regardless of race, color, gender, caste, language, opinion, origin, disability, birth, or any other characteristic. And I say this because for us who are on this call, we program, we plan, we actually develop proposals, but we target not all children. Oftentimes, we are looking for convenient areas to be able to work in. And yet, as advocates, we've been told we're speaking on behalf of children. We need to be capable of speaking even to those that are in the areas that we consider to be difficult to work in. So this is the first, that principle of non-discrimination is very critical. We also need to remember that in that same CRC, it says that some children, need more attention than others or require special care to ensure equality of opportunity. And I draw your attention to the nurturing care framework, which has the pyramid that actually gives us the various levels of services, the universal services for every child. We have those that are indicated services for children who require support, maybe because they have lagged behind because of developmental milestones that have delayed. And then we have those who have special needs, children who have disabilities that are actually given what we'd call targeted support. So we need to be able to remember that some children need more attention than others, but all children have the same right to develop their potential. So as we talk, as we plan, as we go to this conference, this should always be at the back of our mind, non-discrimination. So when you have a rights-centered approach to your programming, you realize rights, not needs. And our challenge is, and as we go into the new cycle of programming for a number of us, as we go into the new political dispensation, we need to begin focusing on the human rights approach and not the basic needs approach, because needs are met or satisfied, but rights are realized. That is, they are respected, they are protected, they are facilitated, and they are fulfilled. I'm looking at the Children Bill 2021 that is currently doing rounds. Look at it and let's see if we're actually seeking to realize the rights of children or we are pushing needs in there. Do not, when you talk about the basic needs approach, they actually take away obligation. They take away the duty from the duty bearer, and that's government. Sometimes we feel like we're doing government a favor by asking them to provide for us certain services, and I'll show that shortly. They always imply correlative duties when you actually a rights-based approach, applying a rights-based approach. A rights-based approach will always be universal, all children. It requires attention to both outcome and process, and I like this because that's the definition of early childhood development. Early childhood development is both a process and an outcome. A process, interrelated services delivered to make sure that a child is able to develop in all spheres, but then an outcome, the healthy, well-being state of that particular child. Now, when you're talking about rights, they are indivisible. They are interdependent. No right is higher than the other. And we need to be capable of talking about that, because sometimes when you're looking at needs, needs are hierarchical. And that's why Maslow gave you that hierarchy of his. We are not going to be planning and programming for children on the basis of needs. We want it to be a rights-based approach. Now, when we move further on, I want to give an example of how we miss it. a needs perspective will tell you that 80% of all children have been vaccinated. And you'll hear that in many of our forums. We talk about 62% of our children are breastfed. We talk about 80% or 76% of our children are enrolled in preschools, etc., etc. Now, that is not the approach we want. We want a rights-based approach, which will now bring to account the fact that 20% of all children have not had their right to be vaccinated realized. So you're looking here now at the 20% and saying, whose child would you want to be amongst that 20% that is not vaccinated? Let's not look at 80% and say that that is the way. Now, a needs perspective, again, will say that the government does not yet have the political will to enforce legislation to register all children. So you have children walking around without registration. But a rights perspective will say the government has chosen to ignore its duty by failing to enforce legislation to register all children. So we want to be able to have that rights-centered perspective in our ECD work as we even move into this conference, to make sure that even when we come up with a communique, we are not talking about needs, but we are talking about a rights-based approach. And as I conclude, children are not born at age 4. We need to be able to make people aware of the fact that the early years are important. In the picture on the right, that mother and the child that is walking looks like what is happening in Kenya. We think that from there, the child will just walk. There are things that need to be done to make sure that early childhood is not just seen as a tokenistic service delivery by government. They can do it as and when they will. No, we need to call them to account and to hold them to account. And I want to stop there by saying, let's remember that we are advocates who have a voice that the children require to speak on their behalf at this conference and beyond. Asante.
Thank you so much, Oscar, for that eye-opening presentation. You know, we in early childhood, we tend to think that we know all the rights of the children, but every time when somebody speaks, you realize that there is something new that is coming up. For example, now we are saying the child is not born at 4, and because that is the focus we give, that at 4 years, we have a policy. At 4 years, we have guidelines on what should be happening. So what happens before the 4 years? That is the question. And I think that is why this year our focus is on children who are below 3 years, the caregiving, the care that they are receiving. How is it going to prepare them for pre-primary schooling? So that is very critical, eye-opening, and I want to believe that we are going to ensure that in what we are going to do and the presentations we are going to make, we are going to tie the presentations to the responsive caregiving in diverse circumstances, innovations, and inclusivity. So that now, whatever we are doing, any presentation we are making, it should be tied to that one. So thank you so much. I want now to invite, I'm not sure, is Ruth here? That is the chair scientific.
Sorry? She's not in yet. She's not in, Daktari.
Okay, thank you. Is Calorinda in, the chair logistics? Okay. Is Immaculate in, our overall chair? Okay. The chair communication, Joyce, is not able to join us. I don't know if she has been able because she told me she's held up somewhere.
She has just joined. She has just joined, Daktari. She's just joined.
Oh, thank you, Joyce. I was trying to put on your shoes. I'm glad you are here. And I want to welcome you. Maybe you want to make some remarks as the chair for communications, and then after that you will take up your role. Over to you, Joyce.
Thanks, Daktari.
Unmute the camera.
Good.
Thank you.
Dr. Mama always has a way of getting me to show my face. Apologies. I joined in late because of some issues that came up. And Daktari, kindly will allow that I will make this presentation, but I may not be able to continue beyond here because of circumstances beyond. But I think for purposes of this webinar and as chair of communications, mine is to appreciate the effort that has gone into all this. We're looking forward to, and as Oscar said, I think I came in while Oscar was speaking, looking at the theme for the conference, Children in Diverse Circumstances. We have a chance and an opportunity to actually showcase, speak about this, advocate for this, and through display of our policy and practice. And as communications, I think we've been at the forefront to just ensure that the voice of the call for attendance of this conference is out. I think we have been steadfast from the very starting point, from scientific committee, of just looking at getting out the concept, the call for abstracts, and just having this conference reach out to as many people, despite the fact that, of course, in July we had to call it off. We've worked hard to ensure that our material is out, that we are reaching out to as many of the stakeholders as possible through academia, researchers, implementers, and more so, I think, also seeking to attract the caregivers who offer this core service, especially for the 0 to 3 every day. I think for us as communications, we want to bring this conference to speak to everyone in the space, regardless, those who are doing and those are implementing and those at policy level, so that we have an honest conversation on the status, understand that there are diverse circumstances, but in each of them, a child remains a child, and that they get the priority of need that they deserve as children. So as chair of communications and just joining in the other team planning committee team members, I want to welcome everyone. Please spread the word. It's my job as communications to spread the word and call on to more attendance, whether virtually, physically. Let's come and have this conversation. And at it, I think at the end of it, our communication will be able to speak to what are the next steps, having identified and understood the diverse circumstances that we come from. We're looking forward to have presentations, both virtually and physically. A lot of networking, a lot of meeting new knowledge, new experiences, and all that, I think, will go towards building a very strong resolve from the community at large on how to take care of our children and put them as priority, because all children matter. Thank you, Dr. Moma. Over to you.
Thank you so much, Joyce, for those insightful remarks. You know, as a communication person, we expect that we hear a lot of communication like we have heard from you. And I want to believe that we are going to make this vibrant. I didn't hear you talk about asking people to start tweeting about the conference and how you are going to share the hashtags so that people can start tweeting about the conference to have as many people as possible joining. I'm not very sure whether now we have the other chairs, at least the communication and the finance have spoken. The other chairs, logistics, or somebody from logistics who can speak on behalf. And then we have the scientific committee and our overall committee member, chair, Immaculate Ama Dr. Lumbe, who has been co-chairing with her. If we do not have them, then I think we will move to the next level.
Terry.
Yes.
Terry, Dr. Lumbe is joining in shortly. Dr. Lumbe is joining in shortly. She's in the attendee list, so she's joining shortly.
Thank you so much. As she is joining, I would request that all of us, I can see we are 32 in number. All of us, ensure that you have registered for the conference. Those of you who are registering for, yes. Yes, Caroline, Linda. Okay, yeah, the floor is yours.
Hello, Dr.
Yes, I can hear you. Can you hear me? Unmute your camera. Hello, Caroline.
Are you able to see me?
No, I cannot see you. I want to see you, but hello, I'm not really. Okay.
Okay, maybe it's
maybe your camera is
I will
Just go on.
Yes, maybe.
Okay, thank you.
So thank you very much for this brilliant opportunity. I would want to focus my my today's talk on the five strategic actions for the
I think we are losing you, Carolina.
We have lead and invest. We have focus on families and their communities. We have strengthened services. We have monitoring. It is out of this conference. Hello. Hello.
We can hear you now.
Hello.
We had lost you, but we can hear you now. Go on.
Yeah. My apologies. I think my network is a bit bad.
Yeah.
But I was saying I want to thank the Ecd network very much for triggering the thought and starting the discussions around early childhood network. And of course, I will want to appreciate the discussions around nurturing care. And this afternoon, I want to talk about the 5 strategic actions: lead and invest, focus on families and their communities, strengthen services, monitoring progress, use of data and innovate. I think the 3 previous conferences that we have had have been very beautiful platforms where we've had communiques that have communicated a lot and a lot of research information that have been shared. And every time we have this conference, we are at a new level. There's a new thing that we are going to focus on, and there's everything is just new. So I would want to say that this year, I have seen a lot of government involvement in discussions around nurturing care, where previously people thought that ECD was just about kindergarten or classroom. I am seeing a lot of government involvement. I am seeing a lot of initiative taken by for example, the Ministry of Health, Division of Neonatal Health. They're already talking about development of an integrated policy so that everyone is on board, so that as we lead and invest, the government leads and everyone comes on board to discuss and talk about where the discussion should actually be. And we are saying that when you invest at early childhood, you are like a person who is building a castle and investing at the foundation. Normally, when you hear people talking about their houses, they talk a lot about, hey, it's the foundation that took me quite a lot of resources. It is the foundation that took me quite a lot of money. And you can see houses that are built with not very good foundation. Some of them fall and cause accidents. So we are saying that the cost of inaction is quite high. So we are rallying everyone to come and let us discuss. Let us refocus. Let us use the bottoms up. Let us focus down there where the foundation is, because it is there where at age 2, 80 to 90% of the human brain is already developed. What do we want? What do we want that brain to be constructed of? We need to invest in that brain. We need to focus on the families and their communities where we work with families, because at the end of the day, this is the first place where the children land. So the families need to know what they need to do to provide nurturing care. We need to strengthen services. And it is very beautiful that ECD, even the first services that are already there, are already services that we only need to strengthen. In the Ministry of Health, for example, what is already happening with maternal and child health programs, we only need to include issues around stimulation, issues around helping caregivers understand their role in brain development, and we have it. So I want to urge all of us, Jaramogi Oginga Odinga University is ready for us. We have our conference hall ready. We even have booths where we will be showcasing a lot of what we've done as a network. And we have several scholars coming to showcase. Let us come, let us learn. Just is waiting for us. And as a chair of logistics, you'll expect that I will talk about logistics. The security around Bondo is actually very good. We haven't had bad incidences in the past. You could be asking yourself about the COVID-19 protocols. They are at par and they're waiting for us. The environment is well taken care of in terms of COVID preparations. So we want to welcome all of us ECD is not the agenda of education. It is not the agenda of health. It is not the agenda of child protection and maybe Department of Children's Services, but it is everyone's agenda. Because at the end of the day, children come from this household. Whether you are, it's actually everyone's agenda to talk about child development, to talk about 0 to 3 years. That is where the foundation of every human being is. But how is the foundation? You want to know more about how the foundation should look like for any child, even children living in different circumstances, children with disabilities, children in prisons. Come join us during our this year's 4th ECD conference. Come and learn more. Come and rally with us so that we convince everyone that the foundation is where we need to put more resources, is where we need to spend more time, and is where we need to invest in more, because the cost of inaction is too expensive. Thank you very much.
Thank you so much, Carolinda, for those remarks that are eye-opening, but I also liked the idea that you have mentioned something to do with the logistics in Bondo. I know many of us will be going to Siaya for the first time, and we may not know how it looks like. So giving us tips about the security around Siaya, around Bondo is very critical. And of course, in terms of COVID-19 protocol, our safety is our responsibility, and it has to start with us to ensure that we are protecting ourselves and protecting those around us. And if each one of us went with that spirit, definitely we will be able to be on the right side. I'm not very sure whether now we have Immaculate, because we said this was going to take 1.5 hours, and we have the next thing as breakaway. Is Immaculate now in?
Not yet, Dr. but Dr. Olumbe, she's gone back to the... Dr. Olumbe is in. So Dr. Olumbe, you have to accept to be promoted. So okay. She's joining as a panelist. Just give her a second.
And I think that's one of the things we need to be careful, so that you don't become a panelist and then you jump out, you go to the common room. And I also want to have a situation where we are going to give those who are not in the panelists an opportunity to ask. Are they going to utilize the Q&A, or are they going to ask questions just like the other normal Zoom meetings?
I think now
they can. Yes, you can see you, Dr. now.
Okay, Dr. Lumbe, it's your time. You can speak.
Okay, I'm sorry. I think it is. I had not joined as a panelist, though I was hearing the discussions.
Okay, now we wanted the chair for the full planning committee to speak, and then they said you are around. If you want to say something before, maybe we break into rooms. But before that, Total News will advise us on whether all the people who are here will have an opportunity to ask you a question or give a comment, just like the other, whatever, by raising up the hand, or whether they will be using the question and answer to icon, or I don't know what you call them. So Dr. Lumbe, can you please speak? And you unmute your camera.
On behalf of Niko Pogari. So if you are okay. Yeah.
Okay. Oh, good.
So,
okay, you can speak.
Yeah, Olumbe here. And on behalf of myself and Immaculate, who have been on the planning team, we are glad that the process for planning these meetings has gone on very well. We've had big support and collaboration from the session, or rather the specific chairs of the different committees, and just trying to see things put in place in preparation for the Siaya conference. We know we still have a few things to put together in terms of just having the logistics sorted out and everyone else having to register. And just to echo the logistics chair, we actually are inviting all of us to ensure that we have registered for this conference, and we are spreading the word as widely as we can. We can have people online and face-to-face at Siaya. What I'm convinced about this conference, and especially as we call several stakeholders on board, is that this conference will have a significant impact in the life of children. We are aware that when we invest in early years, there are very critical things that happen in a child. And so just seeing the showcasing of projects that have been done by different organizations, especially in SIAYA, to better the lives of children, I think it is something very important that will need to be done. But in terms of abstracts and the papers to be prepared, the team and of children.
I think because she's on the road, maybe at some point she's losing her connectivity.
But I believe this conference will make a difference in both the academicians, but also the practice people to see the lives of children enhanced. So we are set to go, and I believe this conference is a welcome to all of us. Thank you very much.
Thank you so much, Dr. Lumbe, for the welcome and for those remarks that you have made. And I'm excited that finally we are here the last week, and I want to believe the conference is going to be a success. I now want to open the session to people to comment, to ask a question by raising up your hand so that we know there is that interactivity. Because today it's a dry run, trying to understand how things will work. So at this juncture, can I see by show of hand the person who wants to speak or to comment or even to ask a question? You can raise up your hand. Okay, I can see one hand. Haddison Yoko. Dr. Haddison, please